You know, the most important veterinary exam your dog will ever get doesn't actually happen on some cold stainless steel table under fluorescent clinic lights.
No, definitely not.
Right, and it doesn't even involve a stethoscope. It actually happens right on your living room floor, maybe with a hairbrush on a totally mundane Tuesday night.
Yeah, that's really the reality of it.
Welcome to today's deep dive. We are looking at this massive stack of sources detailing West Highland White Terrier health, specifically their veterinary care.
And there's a lot to cover here.
Oh, for sure. And our mission today is to extract a pretty massive paradigm shift from all this material. We're going to see how preventive care isn't really about those high-stakes, dramatic emergency interventions. It is fundamentally about the quiet, daily routines you are already doing with your dog.
It completely flips the traditional healthcare model on its head, honestly.
It really does.
Because the core thesis across all these sources is that building a consistent rhythm of home observation is really the only reliable way to catch recurring problems during their most treatable windows.
Right, before they blow up into something huge.
Exactly. So instead of constantly reacting to late-stage symptoms, you are proactively identifying the very earliest, physiological whispers of an issue.
Okay, let's unpack this. Because to understand how a simple, cosmetic grooming session effectively transforms into this secret physical exam, we have to start with the Westie's most famous anatomical feature.
The white coat.
Yes, that bright, coarse, white double coat. I mean, I've always thought of it as just a purely aesthetic breed standard, right? But the clinical literature treats it like an actual diagnostic tool.
Yeah, medically speaking, that white fur acts as a high-contrast background.
Oh, interesting.
Because think about it, in a clinical setting, spotting early-stage inflammation on a dark-coated or brindle dog requires incredibly close inspection. You really have to look.
Yeah, I bet.
But on a Westie, the coat basically does half the diagnostic work for you. So a faint pinkish redness developing between the webbing of the toes or a sudden thinning of hair on the flank, it all just pops.
And what about the saliva staining? I saw that mentioned a lot.
Right, the staining. That happens because the porphyrins in a dog's tears and saliva, they oxidize and turn brown when they hit the air. And all of these things show up brilliantly against that white background.
It's basically the ultimate blank canvas.
That's a great way to put it.
If you spill a single drop of coffee on a crisp white shirt, you know it instantly. So having that built-in visual alarm system is a massive advantage. But, reading through the veterinary notes, I started to formulate a hypothesis.
Okay, let's hear it.
Are we actually getting a false sense of security just because we can spot a brown saliva stain so easily?
Oh, that's a really good question.
Right. It feels like we might be forgetting to actually use our hands simply because our eyes are pulling all the weight. We
Yeah.
just look at them and think they're fine.
What's fascinating here is that the sources explicitly warn about that exact cognitive trap.
Really? So I'm not totally off base.
Not at all. The coat is definitively categorized as both a blessing and a hazard.
A hazard. Wow.
Yeah, because while surface-level epidermal changes are super easy to catch, that dense, double-layered terrier coat is basically a masterclass in optical illusion.
Because it's just so fluffy.
Exactly. So gradual weight gain, or creeping muscle atrophy along the spine, or even subcutaneous lumps they can develop completely undetected if you are solely relying on a visual assessment. The fluff just completely masks the structural reality underneath.
That makes perfect sense. I mean, you look at them, they still look like a little white cloud.
Right, exactly.
But underneath, their body condition score could be shifting dramatically. Which means a true preventative grooming routine demands actual physical palpation. You really have to get in there.
You do. You can't just brush the top layer. You have to get your fingers past the guard hairs and the undercoat.
Like actually feeling the ribs to gauge the fat covering?
Yes, and you need to actively run your hands over the shoulder blades and the hindquarters to assess muscle density. And even part the hair to examine the integrity of the skin barrier itself.
Okay, so speaking of the skin barrier, the data there was intense. The sources have these really stringent directives for Westie dermatology.
Well, they have to, because terriers are uniquely predisposed to compromised skin barriers.
It's not just about keeping them smelling like a puppy.
No, not at all. The skin is literally their largest immune organ. Maintaining it requires a routine tailored to the individual dog's specific microbiome.
Which means what, exactly, in practical terms?
It means utilizing specific lipid-replenishing shampoos if they are prone to dryness, for one, and ensuring that every single grooming tool, along with their bedding, is kept meticulously sanitized.
To prevent introducing bacteria?
Exactly. Opportunistic bacteria love those tiny microabrasions.
And the data on recurring itchiness pruritus, that was fascinating to me. Because I feel like the immediate human instinct when a dog starts scratching is to just run to the pet store and buy, like, a different medicated shampoo
Oh,
or squirt some salmon oil on their food.
oh, people do it all the time.
But the sources draw a hard line here. If itching recurs, you stop the DIY chemistry experiments and you get a veterinary assessment.
Right.
We have this habit of assuming a magical product swap will fix it without even knowing if we're dealing with a bacterial pyoderma or maybe a yeast overgrowth or just an environmental allergy.
And that's dangerous because throwing random over-the-counter topical treatments at a compromised skin barrier can actually disrupt the acid mantle even further.
So you could be making it worse.
Much worse. A veterinarian needs to take a skin scraping or a cytology to actually look under a microscope and identify the specific pathogen. I mean, if you treat a fungal infection with an antibacterial shampoo, you are wasting time.
And prolonging their discomfort, presumably.
Absolutely. And potentially allowing that secondary infection to penetrate much deeper into the hair follicles.
Yikes. Okay. Which naturally brings us to the areas where that skin barrier faces the absolute most environmental stress. Because those hands-on palpation checks we talked about naturally funnel our attention to the extremities, right?
The paws, the ears, and the mouth.
Exactly. Because of their high prey drive and foraging instincts, Westies are just constantly investigating the ground,
Oh yeah, their noses are always in something.
which exposes these specific anatomical zones to just incredibly diverse environmental microbiomes every single day. So you aren't just looking for mud when they come inside.
No, you're looking for microabrasions where environmental allergens can actually enter the bloodstream. The paws are essentially their primary interface with the world.
So checking them is a daily thing.
After every single walk,
Yeah.
checking between the toes, inspecting the palmar pads, and evaluating the nail beds is totally non-negotiable.
What are we specifically looking for in the paws?
You are actively scanning for embedded grass-ons like foxtails, which are awful because they can actually migrate through tissue.
Oh, I've heard horror stories about foxtails.
They're terrible.
Mm-hmm.
You're also looking for thorns, ticks, and crucially trapped moisture.
Yes, okay, the moisture warning really jumped out at me in the reading. The sources are absolutely militant about drying a Westie's paws completely. Like, you cannot just let them air dry after a rainy walk or a bath.
No, you definitely can.
The reason behind this is purely anatomical, right? That dense hair between the terrier toes creates a very specific microclimate,
It creates a literal greenhouse.
a greenhouse.
Yeah, a dark, warm, damp environment that's trapped right against the skin is the exact biological criteria required for Melissatia yeast to just rapidly proliferate.
Because the yeast is already there, right?
Right. It naturally lives on their skin in small numbers anyway.
Yeah.
But that trapped moisture causes a massive population explosion, leading to severe pododermatitis.
So the skin turns bright red.
Red, intensely itchy, and the dog will start aggressively licking their paws.
Which brings up a good point. Persistent licking is never just a dog, like keeping clean, right?
Never. It is a major diagnostic clue indicating localized inflammation or pain.
And the sources are super strict that if you do find something genuinely embedded in the paw or a deep cut, you do not try to play doctor.
Oh, absolutely not.
Digging around with tweezers is firmly a job for the veterinarian.
Right, definitely. Because you can so easily push a foreign body deeper or just introduce human bacteria right into the wound.
Okay, that makes sense. But I want to move up to the ears now because I really have to push back on the preventive advice here.
Okay, let's hear the pushback.
So, the sources are telling us to show serious restraint with ear care. Wait, so doing less is actually better here. I feel like we're conditioned to think a clean dog means scrubbing every inch on a strict schedule. And small dogs with heavy fur are notoriously prone to ear infections. Doesn't leaving the ear alone just invite a massive buildup of gross debris?
It's a completely logical assumption. I mean,
Yeah.
it's totally driven by our own human conditioning that aggressive scrubbing equals better hygiene, right?
Exactly. Clean is good.
But canine oral anatomy dictates otherwise. The ear canal is lined with these specialized ceruminous glands that produce wax. And that wax isn't just dirt. It is a vital protective barrier. It physically traps debris and maintains a specific acidic pH that actually inhibits bacterial growth.
Oh, wow. So it's supposed to be there.
Yes. If you take a totally healthy ear and aggressively clean it on a fixed, weekly schedule.
Hmm.
You are mechanically stripping away their natural defense system.
So by pouring some alkaline cleaner into a healthy ear just because it's like Sunday cleaning day, you are altering the pH,
You're altering the pH and you're introducing moisture.
which, as we just learned with the paws, causes issues.
Right, it causes maceration, it softens the delicate tissue, and actually paves the way for an infection.
So it's doing the exact opposite of what you want.
Exactly the opposite. The clinical guidance here is really just to rely on your senses of sight and smell.
Just looking and sniffing.
Yeah. A healthy dog ear has a very mild, non-offensive odor, and the tissue inside should be pale pink. If it looks and smells normal, leave it entirely alone.
And if it doesn't,
Conversely, if the ear smells yeasty or necrotic, or if it's bright red or producing a lot of discharge, you do not reach for the cleaner.
because it's already inflamed.
Right. That ear is actively inflamed. Pouring a chemical solution into an inflamed ear canal is incredibly painful, and you can actually push infected debris down against the tympanic membrane.
The eardrum.
Yes, the eardrum. That is an immediate trigger to just go see the vet.
So restraint is actually an active form of medical care. I love that perspective.
It really is.
Now, transitioning to the mouth, I have a confession on the dental care front.
Oh boy, okay.
I always just assumed that because terriers are constantly chewing on toys and crunching their dry kibble,
Yeah.
their teeth were getting, naturally scraped clean.
Oh, the kibble myth.
Right. The data in our sources completely invalidates the whole kibble cleans teeth myth.
It is honestly one of the most pervasive myths in veterinary medicine.
Why is it so wrong?
Well, small breeds like Westies have a very specific morphological disadvantage. Their jaws are physically small, but their teeth are proportionally quite large.
So it's super crowded in there.
Extremely crowded. And this crowding creates deep, narrow physical traps for plaque biofilm. When a dog bites down on a piece of dry kibble, the kibble simply shatters.
It just breaks apart.
Yeah, it does not provide the mechanical shearing action required to actually scrape sticky plaque off the enamel,
Yeah.
especially at the gum line, which is where it matters most.
Which means that plaque just sits there and rapidly mineralizes into calculus.
Exactly,
Hmm.
leading to subgingival pockets, bone loss, and eventually systemic issues.
Systemic issues like what?
Well, oral bacteria can enter the bloodstream and actually impact the heart valves and kidneys.
Wow, just from bad teeth. So prevention isn't about feeding dry food. It's about mechanical intervention. Like starting and maintaining an actual toothbrushing routine with enzymatic, dog-safe toothpaste.
Yes, and keeping a sharp eye out for the subtle, early markers of periodontal disease.
Because dogs are pretty tough, right? They hide pain well.
Dogs are masters at hiding chronic dental pain. You shouldn't be waiting for horrific halitosis or for them to completely refuse to eat.
What should we be looking for then?
You are watching for things like slightly escalated bad breath, or a thin red line of gingivitis along the gums, even minor facial swelling, or behavioral changes like dropping kibble out of their mouth or chewing exclusively on one side of their jaw.
It's so incredibly common to just dismiss those signs. People see a dog chewing funny and say, oh, they're just getting older. They're just a bit fussy now.
It happens all the time.
Yeah.
But the clinical data says no, that is a direct physiological response to pain.
And we have to talk about dental chews here, because while they do provide some of that necessary mechanical shearing action we mentioned, the sources highlight a pretty massive caveat.
The calorie density.
Yes, dental chews are highly caloric, and for a small terrier, a single chew can represent a huge percentage of their daily metabolic requirement.
You just cannot treat a dental chew as a free health bonus. That calorie math forces us to look at the dog's entire biological system. Because if we are tracking calories from a dental chew, we are already starting to measure what the sources categorize as the invisible metrics of canine health.
Okay, here's where it gets really interesting to me. We have evaluated the physical terrain, right? The skin barrier, the paws, the ear pH, the jaw anatomy. But the invisible metrics are about how the dog actually fuels that body, how they move through space, and how their neurobiology dictates their behavior.
It's all about establishing a deeply accurate baseline.
A baseline.
Because a baseline is the absolute foundation of preventive medicine. You fundamentally cannot recognize a pathological abnormality if you haven't meticulously mapped what normal looks like for that specific animal.
And measuring intake of fuel is the first metric.
Because the calorie math for a 20-pound dog is utterly unforgiving.
I mean, an extra 100 calories a day is just a rounding error for a human, but it's a fast track to obesity for a little Westie.
Exactly. The sources stress that portions must be precisely measured using a standard measuring cup or a scale, not just some random scoop you leave in the bag.
And you have to factor in those dental chews and training treats.
You do.
Yeah,
And you have to dynamically adjust that intake as their physiological state changes over time.
like when they get fixed.
Yes, when a dog is spayed or neutered, their resting metabolic rate drops significantly.
Mhm.
If you just keep feeding them their puppy portions, they will gain weight.
And as we discussed with the double coat masking those physical changes, that weight gain places exponentially more stress on their joints, which perfectly bridges us to the next invisible metric: movement biomechanics.
The sources highly suggest utilizing movement as a daily diagnostic tool,
Like just watching them walk.
actively watching them, analyzing how they walk toward you and away from you, how they navigate a flight of stairs, noting the fluidity with which they rise from a deep sleep, or the power they generate when jumping onto the couch.
You know, I like to think of this like knowing the normal hum of your car engine.
Oh, that's a good analogy.
Right. If you drive your vehicle every single day, your brain sort of subconsciously maps the acoustic baseline of that engine running perfectly.
Sure.
If you didn't have that baseline mapped in your head, you would never notice that faint, subtle rattle that starts up a month before the transmission completely fails. You are using daily observation to catch the rattle before the breakdown.
The car analogy is incredibly accurate for small breed orthopedics, really, because Westies are prone to structural issues like patellar luxation.
That's where the kneecap slips out of its groove, right?
Exactly. Or early cranial cruciate ligament wear. By establishing a really rigid movement baseline, you can spot a subtly shortened stride in a hind leg, or just a slight weight shifting while they're standing, or even an intermittent skipping step on a walk.
Just a tiny skip.
Yeah, these are the earliest mechanical compensations for joint pain, and they appear months before a persistent, obvious limp forces you to actually go to the vet.
And the final invisible metric ties directly into that pain response, doesn't it? Mood and behavior.
It does.
Because a dog's behavior is simply a communication of their internal physiological state. If your dog experiences, like, a sudden alteration in how they sleep, or an unexplained increase in barking, or just a sharply reduced tolerance for being handled, you have to look at the biology behind that behavior.
Because chronic low-grade pain elevates their systemic cortisol levels, which in turn dramatically alters a dog's threshold for external stimuli.
They just have less patience.
Exactly. A massive element of the veterinary sources focuses on cooperative care. A dog that has been conditioned to tolerate handling, like standing calmly while you spread their toes, or remaining still while you lift their lip to expose the molars, they're going to have a fundamentally more accurate and much less traumatic veterinary exam.
But the critical takeaway here is diagnostic, right? If your historically cooperative dog suddenly tenses up or pulls their paw away aggressively or lip curls when you reach for their ears, the sources are completely definitive on this.
They are. You must treat that behavioral shift as a physiological clue about acute discomfort.
It is not a sudden, stubborn lapse in training that requires a correction.
Absolutely not. Their pain pathways are firing, and they are using literally the only communication tool they possess to say, hey, the tissue in this area is inflamed today.
Dismissing pain-induced reactivity as just bad behavior is probably one of the quickest ways to miss a developing infection or an orthopedic injury.
Without a doubt.
Okay, so we've gathered this incredible wealth of home data. We understand the optical illusion of the double coat, the microclimates of the paws, the pH of the ears, the jaw anatomy, and the biomechanical baselines of movement.
It's a lot of data.
It is. The final layer of our deep dive really focuses on synthesis. How do you take this mountain of daily observation and transform it into an actionable clinical partnership with a veterinarian?
The translation mechanism here is rigorous documentation.
Writing it down.
Yes. The clinical literature heavily emphasizes the diagnostic power of recognizing cyclical patterns.
Give me an example of that.
Well, if you document that your Westie's aggressive paw licking and flank itching flares up in mid-August every single year, that ceases to be a random annoyance. You have just handed your veterinarian the vital longitudinal data required to diagnose a seasonal environmental allergy, rather than wasting months testing for food allergies.
Oh, that makes so much sense. And technology has totally revolutionized our ability to capture this data, hasn't it? The sources strongly advocate for using your smartphone as an actual medical tool.
Oh, definitely.
If you find a subcutaneous lump during your palpation check, you can just take a photo of it with a coin next to it for scale. That way you can objectively track its growth rate over weeks.
And capturing video of those movement anomalies is absolutely critical too.
Why is video so important?
Because video bypasses what we call white coat syndrome.
Oh, right, when they get nervous at the vet.
Exactly. When a dog walks into a veterinary clinic, the novel environment triggers their sympathetic nervous system. That massive spike in adrenaline and cortisol actually temporarily overrides their perception of pain.
Wait, really? So they don't feel it?
Not in that moment, no.
Yeah.
So the dog that was intermittently skipping at home will suddenly walk with perfect fluid biomechanics for the exact 5 minutes the vet is watching them.
Adrenaline literally masks the lameness.
Exactly. If you have the skipping on video, you provide the vet with the unmasked mechanical reality.
That is such a pro tip. Now, regarding the actual clinic visits themselves, I notice a huge point of confusion for owners is scheduling, but the source is cut right through the noise here. There is no single universal template for vet visits, vaccination intervals, or diagnostic screening.
No, because high-quality medicine is inherently individualized. A Westie living in a high-rise apartment in a major city has a completely different risk profile than a Westie living on a wooded rural acreage.
So your routine has to match your life.
Right. Your vaccination titers and screening tests must be dictated by your regional epidemiology, the dog's specific travel habits, how often they're boarded, and their genetic history. The veterinary consensus warns strictly against running broad diagnostic panels without clinical context. Testing must be driven by observed clinical signs or specific predispositions, not just testing for the sake of testing.
And we definitely have to address the urban parasite myth because it directly impacts that localized risk profile.
Oh, this is a big one.
There is this pervasive misconception that an indoor or primarily urban dog is just magically shielded from fleas, ticks, and vector-borne diseases.
And the data completely shatters this. Fleas travel very easily into apartments on human clothing, for one.
I never even thought of that.
And urban parks are actually thriving ecosystems for rodents and wildlife that carry leptospirosis and drop infected ticks right in the city.
Yeah.
You cannot guess on parasite prevention. You have to utilize veterinary epidemiology based on your exact zip code.
Because vector biology doesn't respect city limits.
Exactly. Ensuring you have the correct preventative protocol alongside knowing the exact road to the nearest 24-hour emergency clinic and keeping an updated dossier of current medications and weight, well, that basically constitutes the baseline of medical preparedness.
But looking at all of this, the daily palpation, the charting of seasonal itching, the video recording of their gaits, the strict calorie counting, I have to play devil's advocate for a second. At what point does this level of intensive observation mutate into being just an incredibly anxious helicopter parent? Is the goal to just hover over our dogs with a clipboard, terrified of every single biological hiccup?
If we connect this to the bigger picture, the explicit goal outlined in the literature is to become attentive without being anxious.
Attentive without being anxious, I like that.
Information overload certainly can trigger anxiety, but honestly, only if you lack a framework. The objective isn't to treat a slightly soft stool or a single random cough as a 5-alarm crisis. The objective is simply data logging. And this framework becomes the absolute most powerful tool you possess as the dog enters its senior years.
Because aging isn't a cliff they suddenly fall off.
Exactly. Cellular senescence and sarcopenia, which is age-related muscle loss, happen incrementally. It is a progression of micro-changes.
Like what?
A fraction of a second slower rising from the dog bed. A millimeter less muscle mass over the hip joints. A slight dulling of the coat. If you haven't been paying attention, you will inevitably panic when these changes accumulate enough to become visibly obvious all at once.
Right, because it feels sudden, even though it wasn't.
Exactly. But if you have spent years calmly mapping their baseline, you recognize the subtle shift early. You don't panic. You simply adjust their joint supplements, modify their exercise routine, and gracefully adapt their care, rather than being totally blindsided by the realities of aging.
Attentive without being anxious. So what does this all mean for you listening right now? The greatest takeaway from this whole stack of veterinary literature is that world-class preventive care isn't some stressful high-tech ordeal.
Not at all.
It is built entirely out of completely ordinary mindful moments. It's finishing that Tuesday night brushing session, putting the brush down, and noticing that the space between their toes is just a shade pinker than it was last week.
And instead of spiraling into worry, you simply log the data, adjust the routine, and move forward.
And by mastering this quiet, consistent rhythm of biological observation, you save yourself an immense amount of reactive stress. You catch physiological shifts during those early, inexpensive, and highly treatable windows.
And most importantly, you ensure your dog actually thrives systemically, rather than just surviving the gaps between emergency clinic visits.
And if you're looking to actually implement this framework, the sources did highlight utilizing digital tools to organize that mental load. They specifically noted the Vital Pet app as a centralized hub for logging those baselines, weight trends, and vaccination histories.
It's a great tool.
And of course, the mandatory medical caveat. Our deep dive today is for educational exploration of the provided texts. Your local veterinarian who actually knows your dog's specific clinical history always remains your ultimate medical authority.
Because the modern veterinary model is a true partnership. It's your deep, daily observational data combined with their advanced clinical expertise.
Exactly.
And exploring this partnership leaves me with a final, slightly provocative thought to maybe mull over long after this deep dive ends.
Oh, let's hear it.
We just spent a significant amount of time learning how to decode the subtle, quiet, physiological language of a dog's health through the rigorous tracking of daily baselines. But what if we applied that exact same level of attentive, non-anxious observation to our own human bodies?
Oh, wow.
Right? How many of our own biological check engine lights do we actively ignore every single day simply because we haven't taken the time to truly learn our own baseline?